Good afternoon. My name is Milena, and this is my presentation of my professional development interview with Dr. Camille Hamilton. Uh, she is a nurse practitioner working and practicing around Allentown, Pennsylvania, and she fell into my lap, and it was wonderful, and she's an absolute joy. So I'm excited to talk about her. So, first thing is, why did I choose a clinical provider? Well, it's something that aligns with my own professional goals. I personally want to become a doctor, and I wanted to be able to use a public health tool set to be able to serve my patients a little bit better with a little more grace and recognize the overall, bigger picture of what makes their health, what determines their health, and how we can fix it. Because there is a huge disconnect between public health and clinical practice. In fact, a lot of my coworkers have asked me, what are you going to do with this master's program or this master's degree? And I tell them, and I get blank stares, because a lot of people, or a lot of practitioners, a lot of nurses, for one reason or another, they want to do the part where they're healing the sick, but then kind of forget everything else. And unfortunately, that's just the way that American healthcare is. It's how providers are trained, and it's something that I'm acutely aware of and understand needs to be fixed. So, I also live in a very big city. I am a very tiny fish in a very big pond. So, when I originally reached out to providers, doctors that had MPH at the end of their name, it was crickets. I had lost all hope. I was unsure what I was going to do next, but I knew that I wanted a provider because I knew that I needed to have this conversation with somebody. And then there was hope. I was at work. A coworker of mine heard me voicing my concerns about not finding the right person, and he was like, "Hey, my wife is actually a nurse practitioner with a master's of public health." And then I immediately asked for her number. She's very gracious, and so is he, and it was super rewarding to speak to her. Okay, so who is Camille? She has a PhD in nursing science. She has a master's in public health, like we said, a master's in science and community health nursing. She is an adult gerontology primary care nurse practitioner, which means she specialized originally in hospice and geriatric care. She's obviously a nurse, and she's a certified medical surgical registered nurse. So there are a lot of letters at the end of her name. She is an extremely intelligent, wonderful woman, and she has spent 25 years in nursing and public health across, again, gerontology, women's health, addiction medicine, primary care, and hospice. So, former roles of hers, she was a director of the undergraduate nursing at Long Island University, and she was also a lecturer at Long Island University, Hunter College, and Yale. So, needless to say, I was a little overwhelmed. When she sent me the CV, I had no idea how long it would be. Her current role now, she's a nurse practitioner with Valley Health Partners Street Medicine Program in Lehigh Valley, which again is around Allentown, Pennsylvania. Fun fact, she's a Mary Kay National Sales Director. That's supposed to be a Kay, not a Kary. I apologize. She is a Cadillac Award winner for leadership and mentorship, and that actually plays a huge role in her leadership roles. Believe it or not, it's very interesting to hear. Again, her current role, she's a nurse practitioner. She is with the Street Medicine Program. Their mission is partnering with the people of our community to achieve health and wellness through the delivery of extraordinary care that is compassionate, accessible, and affordable in a family-centered and welcoming environment. It's a small team, 4 providers, nurse practitioners, and physician assistants, 1 behavioral health therapist, a criminal justice liaison, certified recovery specialist. This last one is important because they purposely search for people who have dealt with substance abuse and homelessness, um, who put them in those roles so that they can understand the population that they're working with. So their day to day, they start at 7 a.m. They visit encampments, woods, shelters, cars. They deliver primary care on chronic diseases as management in the field. So they go out into the woods, again, shelters, what have you, with hypertension medicine, diabetes medicine, and they reach out and they just check in on them, check in on their health, and check in on their not just their physical health, but their mental health as well. Um, they address social determinants of health. So if a patient needs housing, needs certain IDs, transportation somewhere, food access, they're there. In fact, she has actually gone to court dates for these people. There was one time where a patient of hers asked her to be at a court date, and she showed up. She was there, and the patient was so excited. She came out, hugged her boyfriend, and then told her boyfriend, "See, I told you she'd be here." They never let us down, which is a huge, like, it's a it's a huge role that they play in their patients' lives. Um, so she also operates a medical respite program for patients recovering from surgery or acute illness without housing. So for patients, say, who have breast cancer, if they don't have a space to recover properly, they will put them up in a hotel and give them some space. All right. So then we have the population that she serves. Again, individuals experiencing homelessness, substance use disorders, mental health conditions, and chronic illnesses. Challenges are lack of trust. She has to have a trauma-informed approach because every single one of these patients have trauma. They have limited access to basic needs. They have been let down by the system time and time again. There are cycles of incarceration and relapse. So it's a lot of her stepping up and being there, specifically building that trust with them, which they're all very mistrusting. But she says the main point is to don't promise too much, right? Stay true to your word, be there for them, and let them know that they have somebody on their side. So the public health services that she is a part of, I would say there are a few. She assesses and monitors population health. Again, she's out there every day. She's assessing the population health of her patients, depending on where they are. She's investigating, diagnosing, and addressing any health hazards and root causes in their lives. So again, homelessness, substance abuse disorders, things like that. She's directly addressing. Communicate effectively. Number 3, to inform and educate. She's educating these patients every day on their health and what needs to be done. She's enabling equitable access. That's number 7. She's giving housing, ID assistance. She's there. She's going out into the woods and making sure that these people get the medication and the care that they need. Number 8, build a diverse and skilled workforce. Again, she's an educator. She mentored students. She was a lecturer. And she, again, also that substance abuse specialist position that she has. That's also part of building a diverse and skilled workforce, because they are really the only ones that know what it's like to go through that. And then number 9, improve and innovate through evaluation, research, and quality improvement. She finds herself at plenty of conventions, giving research and any data that she might have gotten out in the field. She's reported them. She's spoken at these conventions. The last one, I think, was in Hawaii, and they use that research for up-to-date information on how to better serve this population. Key takeaway, number 1, advocacy is the heart of public health, and MPH is more than just an addition, and that's super important for any practitioner or provider that chooses this path. And this is probably the exact reason why I chose to get a master's in public health regardless. Advocacy is huge. Dr. Hamilton feels the same way. It is part of every patient encounter. If you are not there to advocate for your patient, what are you doing? Honestly, that's how I feel. That's how she feels. Um, she doesn't just refer patients. She calls, she shows up, she follows through. There are points where, like, if she's sending her patient to the ER for something, anything, she will be there with that patient because she's advocating for her patient, not just to make sure that the patient gets to the ER, but also to make sure that the people in the emergency room are listening to this patient and recognize that this patient does, in fact, need help. She acts for a voice for our community using on-the-ground data to inform systems and policies. Key takeaway 2, meeting people where they are. Her care model is built on trauma-informed, culturally aware practice. Like I said, they all have trauma, but people are also their culture. So it's understanding little things. Understanding that a patient would rather try one particular kind of care than the other. She'll say, okay, that's great. When you're ready to try the next one, if you want to, I will be here. And building that trust, those small little gestures of recognizing that people are, again, their culture, goes a long way. She celebrates small wins. So again, another thing that Mary Kay taught her in her leadership training. So little things, if she has a patient that didn't throw a fit, didn't, you know, didn't take any substances, didn't, have any outbursts when something really stressed them out. Even it's a little thing of like, hey, you didn't punch a wall today. That's a small win and she will celebrate it. And again, emphasizing dignity, empathy, and presence. No one should leave my care feeling worse than when they came. So basically, whatever she does is understanding the humanness of the people and making that person in front of them feel like the most important person in the world. Okay, I'm going to leave you with one more quote because she had so many great ones. And that is, it's a privilege to be in a leadership role. People depend on us. If we stop, everyone else stops. That's my presentation. I apologize. It's definitely more than 5 minutes, but she was so great to talk to. And she had so many nuggets of wisdom. And I learned so much. And I hope that you learned a lot too. Thank you.